My name is Abigail, and I'm going to be talking about mucositis and stomatitis. And I'm going to pull up the PowerPoint. Mucositis and stomatitis. So mucositis can actually occur anywhere along your GI tract, and your mouth is part of your GI tract. So oral mucositis occurs only in the oral cavity. And the most common occurrence of this is in patients who are undergoing chemo or radiation. The reason is that chemotherapy and radiation are targeting cancer cells which rapidly proliferate, but there's also a lot of other cells in your body which rapidly proliferate, and the cells in your oral mucosa are such cells. It can be caused by minor oral trauma, maybe a utensil slipped at the dentist office, but the most common causes in relation to patients undergoing chemotherapy or radiation. Because it's caused by cancer drugs, it's not treatable with antibiotics, and it is not preventable, unfortunately. And 40% of patients who are undergoing chemotherapy and radiation will at some point develop oral mucositis. And because of this, a soft diet is advised, because if you're eating foods that are very rough or have sharp edges, they can damage your mouth even more. Risk factors include being female. Obviously, the big one that I didn't mention on here is chemotherapy. That's kind of the unspoken. So being female, smoking, tobacco use, alcohol consumption, those are going to change the cells in your mouth even more. Having another comorbidity, like just for example, kidney disease or diabetes, and having an unusually low BMI going into chemotherapy, that's a risk factor for developing oral mucositis. So signs and symptoms. Typically after chemotherapy is finished, within 1 to 3 days, you'll start to see some symptoms of this pop up. Before there's visible tissue change, you'll have just discomfort and pain, mild redness along the gums or the soft part of your lips here. And then it will turn into a ulcer, maybe a little bit yellow or white color inside your cheeks, on your lips, or the underside of your tongue. And your gums will be shiny and swollen with those soft white patches. And during eating, it can be particularly painful because the food will irritate it even more. Moving on to stomatitis, there are two types of stomatitis. One type is caused by the herpes simplex virus type 1, which is more commonly known as cold sores, but it's oral herpes. And then aphthous stomatitis, or canker sores, is the second type of stomatitis. For now, we'll focus on oral herpes, and so signs and symptoms. This is very common in children because the HSV type 1 is passed by physical contact, and little kids are touching everything and putting their hands on their mouth, and they don't know about hand hygiene. So this occurs most commonly in children. Adults can get this, but since little kids are always touching things, that's who you're going to see it in most likely. Once you are infected with HSV, the viral particles will be present in your body for life. So reinfection is likely. There is actually some conflict in information here. Some sources say that the viral particles will disappear after time. Other sources say that the viral particles are present for life. So a little bit of a question mark on that one. But reinfection, bottom line, you can get reinfected. So with the phases of this, it starts with the prodrome phase, and this lasts for 1 to 2 days. At the site where the ulcer will occur, you'll have tingling, just an unusual sensation there. Maybe some itching, some burning, inflammation, and erythema or redness. And then the prodrome phase, lasting 1 to 2 days, ends with the appearance of a blister. And initially, that blister will have clear yellow fluid that is contained by the skin covering, but eventually, either if you rupture it yourself or whatnot, it will rupture and it will weep yellow white exudate. That exudate can infect other people. So if you happen to get that on your hand and you touch somebody else, well, you've just infected them. Over time, the weeping of this ulcer will heal, and a scab will form That scab breaks easily, especially if you have one of these cold sores on the corner of your lip where your mouth is moving. So those scabs come and go over time. Total time for the lesion to be healed is about 10 to 14 days. So we said it's spread through physical contact with the actual cold sore ulcer lesion itself, or from the exudate, and then kissing, oral sex, sharing utensils, or transferring the exudate to somebody else are all ways that you can pass this infection along. Moving to the aphthous ulcers, or canker sores, these are idiopathic in nature, which is interesting, but there are certain risk factors that can make you more likely to get these little canker sores in your mouth. They're more common in young females for whatever reason. There's a higher incidence in younger females, and oral trauma can make you more likely to have these canker sores. Stress, because it lowers your immune system and now you're more susceptible. Certain foods can irritate your mouth. Now, these are not food allergies. These are not foods that you would be allergic to. They're just foods that cause some irritation in the mouth, and they're listed there. Also, a Helicobacter pylori or H. pylori infection is a risk factor for having canker sores. It's just a shallow white lesion on the soft tissue of your mouth. No exudate, it's not contagious. It's painful, but it'll go away on its own. It's self-limiting within 1 to 2 weeks. It is thought that a diet that is deficient in vitamin B12, zinc, folic acid, or iron can contribute to the incidence of these ulcers. And Winter will share the rest of the information.